Welcome to the Resource Allocation Decision Tool, Help Video 4.1. My name is Terry Haines. This video focuses on what are economic evaluations. Why do we care about economic evaluations? Well, we care because funding available for healthcare is limited, and yet demand for healthcare from the community is insatiable. Inevitably, we will have to say no to providing some programs to some people. If we're interested in maximising the benefit our health budget can create, we need to understand both the costs and consequences of each program that we can choose. The Resource Allocation Decision Tool asks you the question: in ideal circumstances, based on the evidence, what is your best judgment of how cost-effective this option could be in addressing the problem? Is it highly cost-effective, cost-neutral, not cost-effective? There are some basic principles of economic evaluations that you need to understand in making this assessment. First, full economic evaluations always compare alternatives. Full economic evaluations consider both the costs and the consequences, or the health impacts, of these alternatives. Economic evaluations are taken from a particular perspective, whether that be the costs and consequences incurred by patients, by a health service, by a government, or more broadly, from society as a whole. Economic evaluations are conducted over a specific time period. This might be a 12-month time horizon, or something shorter or substantially longer than that. Finally, economic evaluations consider opportunity costs. Opportunity costs are the best alternate use of a given resource. So, if we had an intervention that used volunteers for provision, even though the hospital may not have to pay the volunteers money to provide that intervention, there is still an opportunity cost. Those volunteers could be working in another area within the hospital to generate resources, to generate income or productivity for the hospital. Now, the measurement of costs can be broken down into different categories. Commonly, direct health costs are measured in economic evaluations of health interventions. This might include the cost of program provision, but also the future healthcare resource use that might be averted. So, when thinking about preventive programs, avoiding hospitalizations or other healthcare resource use from avoiding the negative health outcome that would lead to them. There are also direct non-health costs that might be attributable to an intervention. For example, transportation, special education, or perhaps even judicial system costs. There are indirect costs which describe changes in productivity. In the field of lower back pain, the burden of disease of this particular condition is largely driven by losses in productivity, in paid and unpaid work that people who experience lower back pain incur. Finally, there are intangible costs such as pain, depression, anxiety.